Trastuzumab-Dttb 150 mg intravenous solution is a medication used to treat certain types of breast, stomach, or esophagus cancer. It is specifically used to treat tumors that produce more than the normal amount of a certain substance called HER2 protein. Trastuzumab-Dttb belongs to a class of medications known as monoclonal antibodies, and it works by slowing or stopping the growth of cancer cells. It is important to take this medication as directed by your healthcare provider, and the dosage may vary depending on your specific condition. It is typically administered as an intravenous solution, and the optimal timing for taking this medication should be discussed with your doctor. When using Trastuzumab-Dttb 150 mg intravenous solution, it is typically administered by a healthcare professional through a slow injection into a vein. This is usually done once a week or once every 3 weeks, with the first injection taking at least 90 minutes. The dosage of this medication will depend on your medical condition, how you respond to treatment, your weight, and any other medications you may be taking. It's important to inform your doctor and pharmacist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. In order to receive the most benefit from Trastuzumab-Dttb 150 mg intravenous solution, it's important to use it regularly. To help you remember when to receive the medication, you can mark the days on a calendar. Your doctor may also prescribe other medications, such as acetaminophen and diphenhydramine, for you to take before each dose. This is to help prevent serious side effects, so be sure to follow your doctor's directions carefully. Common side effects of Trastuzumab-Dttb 150 mg intravenous solution may include redness or irritation at the injection site, diarrhea, muscle or joint pain, stomach or abdominal pain, headache, trouble sleeping, nausea, vomiting, mouth sores, and loss of appetite. Some people may experience severe nausea and vomiting, for which your doctor may prescribe medication. Eating small meals, avoiding food before treatment, or limiting activity may help reduce some of these effects. If any of these side effects persist or worsen, contact your doctor or pharmacist. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefit outweighs the risk of side effects. While many people using this medication do not experience serious side effects, it's important to seek medical attention if you experience symptoms of heart failure, bone pain, numbness or tingling, changes in mental or mood, fast or irregular heartbeat, easy bruising or bleeding, chest pain, weakness on one side of the body, trouble speaking, vision changes, or confusion. Trastuzumab-Dttb may lower your ability to fight infections, increasing your risk of serious or worsening infections. Contact your doctor if you experience signs of infection, such as a persistent sore throat, fever, chills, or cough. While this medication can cause a rash, it's usually not serious. However, it may be difficult to distinguish it from a rare rash that could be a sign of a severe reaction. Notify your doctor immediately if you develop any rash. Although rare, a serious allergic reaction to this drug is possible. Seek immediate medical help if you experience symptoms of a serious allergic reaction, such as rash, itching or swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects. If you notice any other effects, contact your doctor or pharmacist. Trastuzumab-Dttb 150 mg intravenous solution, also known as trastuzumab, is a medication used to treat certain types of breast cancer. It works by targeting specific proteins in cancer cells to slow down or stop their growth. It's important to note that trastuzumab may cause serious heart problems, including heart failure. This risk is increased if you also use another type of medication called an anthracycline. If you experience any symptoms of heart problems, such as trouble breathing or weakness, it's crucial to contact your healthcare professional immediately. Additionally, reactions may occur with the injection, typically during or within 24 hours of receiving the dose. It's essential to be closely monitored for any signs of a reaction. If you experience symptoms such as fever, chills, headache, or dizziness, it's important to notify your doctor right away. They may decide to slow down or temporarily stop your injection to prevent any further complications. It's also important to mention that trastuzumab can cause serious harm to an unborn baby if used during pregnancy. Therefore, it's crucial to discuss reliable forms of birth control with your doctor if you are of childbearing age. As for the optimal timing of taking this medication, it's best to follow your doctor's instructions on the dosage and the frequency of the injections. It's important to take the medication exactly as prescribed to ensure the best results. Before starting trastuzumab, make sure to tell your doctor or pharmacist if you have any allergies or medical conditions, especially if you have had infections, heart or lung problems, or previous cancer treatments. Trastuzumab can increase your risk of getting infections or make existing ones worse, so be careful around people who are sick. Also, let your healthcare professional know if you need any vaccinations. Be cautious with sharp objects and avoid contact sports to prevent injuries. This medication may cause dizziness, so avoid alcohol and marijuana. Before any surgery, inform your doctor about all the medications you are taking. If you are pregnant or breastfeeding, talk to your doctor about the risks and benefits of using trastuzumab. It's important to be aware of the potential interactions with other medications, as they can affect how this intravenous solution works and may increase the risk of serious side effects. Make sure to keep a list of all the medications and products you are using, and share it with your doctor and pharmacist. Do not make any changes to your medication without consulting your doctor. Additionally, it's crucial to note that trastuzumab is very similar to other medications such as trastuzumab deruxtecan, trastuzumab emtansine, and trastuzumab hyaluronidase. Therefore, it is important to avoid using any of these products while using trastuzumab intravenous solution. Always follow your doctor's recommendations and guidelines. If a person has taken too much Trastuzumab-Dttb 150 mg intravenous solution and is experiencing severe symptoms like fainting or difficulty breathing, it is important to seek immediate medical attention. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. Before starting to use Trastuzumab-Dttb 150 mg intravenous solution, it is important to undergo certain lab and medical tests, such as heart exams and complete blood count. These tests should also be continued during the use of this medication. It is essential to keep all medical and lab appointments to ensure the proper monitoring of your health. Make sure to take each dose of Trastuzumab-Dttb 150 mg intravenous solution as prescribed by your doctor. If you happen to miss a dose, be sure to consult with your doctor or pharmacist immediately to determine the best course of action for a new dosing schedule. Since this medication is administered in a hospital or clinic, it will not be kept at home. This medication is used to treat certain types of breast cancer and stomach cancer. It is given as an intravenous infusion, usually once a week or once every 3 weeks, depending on the condition being treated. The optimal timing of this medication should be discussed with your healthcare provider. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.